electrocardiogram, or the ECG, is the most widely used diagnostic tool in medicine. This clinical device provides a graphical representation of all the heart's electrical activity at a given time. The doctor can then analyze these electrical recordings and judge the health of cardiac muscle as well as the efficiency of each cardiac contraction. The ECG plays an important role in the diagnosis of heart disease. First, this paper will examine the history and development of the electrocardiogram, following its transition from the laboratory to the hospital bedside. William Einthoven first described the ECG in 1901. The original instrument consisted of a string galvanometer, an optical system, and a camera, which together weighed over 600 pounds. The first commercially produced electrocardiogram was manufactured by Cambridge Scientific Instruments in 1908 and was sold to laboratories, universities, physicians, and hospitals around the world. Not only was the ECG a useful tool for laboratory investigations, but it also received clinical importance in the hospital. Doctors began to use it to diagnose cardiac patients. It continued to gain clinical significance when Sir Thomas Lewis began his studies with arrhythmias through the years of 1909 and 1920. It finally was legitimized as a diagnostic tool after James Herrick, an American doctor, characterized the changes in electrical recordings following a myocardial infarction, or a heart attack. The ECG was the first cardiac instrument to successfully make the transition from the laboratory to the hospital. Secondly, this paper will examine how the introduction of the ECG affected patient care at Kingston General Hospital. The ECG was very important in the evolution of cardiology as a medical specialty. It provided greater insight into the mechanics of the heart, as well as delivered a more accurate way to diagnose cardiac disease.